One of the most controversial and challenging but also heartbreaking disease conditions that we see is going to be this aspect of elbow dysplasia. We see a very, very high percentage of mainly medium to large breed dogs, but sometimes small breed dogs, affected with elbow dysplasia. And they can come in at a very young age, sometimes 5, 6, 7, 8 months old. And the unfortunate nature is that the current solution is that we don't have a definitive treatment strategy for these.
Canine elbow OA is very, very challenging to treat. And then even after surgeries, like we have, for example, we have now different type of elbow replacement systems, but they're not successful. There's a high complication rate. So canine elbow OA is very challenging. Even using all the things that we have available in our hands, there are still a lot of patients that are still lame and painful, and we're unable to completely make them pain-free or symptom-free at this point.
Elbow dysplasia, elbow arthritis is a whole different story. So we don't have a good surgery to change the course of the disease in dogs that have elbow dysplasia, be it fragmented coronoid process or UAP or OCD. We can do surgery, and there's a variety of different surgeries out there, but ultimately there's nothing that's going to prevent the progression of OA in these dogs.
In many cases, surgery for elbow dysplasia, surgical treatment, whether that's arthroscopy, whether it is an interventional surgery to alter weight bearing in the elbow joint, whether it's even something as dramatic as an elbow replacement, in many cases, if you look at the literature, if you look at the experience of surgeons that have treated many elbows, the outcomes are not as good as we would hope for, and they don't last as long as we would hope for. And as a surgeon, I'm always looking for treatment options that get better results, that are less invasive, that keep patients as comfortable or more comfortable than what we're currently doing, with lower risk and less invasiveness.
The key considerations for me when addressing the pain and inflammation associated with elbow osteoarthritis is going to depend on a number of factors in the dog, but ultimately pain management is everything that we're going for. If it's a young dog that has a suspected fragmented medial coronoid process, I'm generally going to do arthroscopy and remove that, as we described, pebble from the shoe. But I'm also going to talk to the client about, I know that this is not going to change your dog's joint long term. We're not giving them a normal joint. So there's going to be a lot of long-term management of that OA that we need to do. If I see a dog come in that has a moderate to severe osteoarthritis of the elbow, may or may not have had previous arthroscopic surgery or elbow surgery, this is going to be a case where we have to do a lot more interventions that surgery is really not going to make a big difference for.
There's a lot of debate on, is there a significant success rate in simply scoping these joints and addressing a fissured coronoid process, or do we manage it more conservatively? And I think the reasoning, because there's not significant differences between, say, an arthroscopic approach or a conservative approach in some situations, is because we're not getting to the underlying aspect of why this patient has elbow dysplasia. What I would say in general is if a patient has any sort of intra-articular pathology, particularly if there is effusion or instability of a joint, we can almost assume that there's going to be some degree of synovitis. We can see patients that have pristine radiographs of the elbow, but if we were to scope that elbow and look arthroscopically, if there's very small cartilage damage, there tends to be a very severe synovitis globally throughout the joint itself.
There are not very many good options. There's a lot of literature, a lot of surgeries have been tried to address elbow dysplasia problems. But a lot of times, even after those surgeries, those dogs are still painful, they're still limping, they still have muscle atrophy.
And I personally think that more than anything, that synovitis is really what's contributing to the pain and the discomfort. And it's one of those avenues that we have not yet addressed or begun to address. And if we are able to take those patients, whether we scope them or treat them conservatively, but address the underlying synovitis, I think we can add another level on success with some of these dogs.